Hi, my name is Akash Sharma. I'm at the Nuclear Medicine Division in Florida. So giving an update today on our division, our department for Florida specifically. Dr. Parent is my colleague who's here off camera, but we'll be covering things really on behalf of the entire department, the entire division. So this is the division. Dr. Manoj is our chair, Dr. Curzo, myself, and Ephraim joined a year later. And then we have Dr. Wasserman and also Dr. Sai is our cyclotron supervisor, and Debbie is the representative for all the technologists who, of course, are part of the team. And this is Mayo Clinic, Florida campus. You can see the main three buildings. This is Davis Building where we live. This is Mayo Main Hospital, and this Canada, which is the outpatient internal medicine area. What we don't see, or what you don't see, is that there's a 400-acre campus, and there's a lot of growth going on. This building is going to grow by several floors, and it's going to have more outpatient internal medicine. We've already got a building here, so this is really a moment in time. This was maybe a year and a half ago. So this building here already, Mayo 2 South, which now has a molecular imaging wing on the second floor. Off over here where there's a red marker is where the cyclotron went in, and then off the screen to the left are the new innovations campus, the small animal imaging, and so forth. So this is really a very small images, but it's the best aerial image I could get. I've got an overview, bird's eye view of the nuclear medicine footprint for Florida. So we live in the Davis building primarily, and that's where we have our outpatient clinic, PET-MR, as well as personalized therapy. In addition, the red mark is where the cyclotron is currently located. The green mark is the small animal imaging. And purple is the hospital. We do have cameras in the hospital. And then the blue marker is the new Mayo South expansion building where the molecular imaging wing went in. So this is the cyclotron building, the picture of the Jacoby family. They were kind enough to be our donors for this particular installation. So inside it houses a cyclotron as well as the radiochemistry lab. Dr. Sai is running this with his team, and it's got intention to expand. You can see the purple areas are where the current hot cells live, but the trench can also easily accommodate more. And we certainly intend to do a lot more research radiotherapeutics in addition to the FDA-approved therapeutics that we've now already started making every day and we're clinically using every day. So when I arrived 3 years ago, we had one PET-CT scanner. It was about 10-year-old technology. We were using it quite heavily. In the last 2 years, we've grown tremendously. We have a PET-MR 3 Tesla. We've got a cyclotron that's now operational. We had one PET-CT added last year and then another PET-CT added this year. We've also started doing clinical radiotherapy quite extensively, more than 100 therapies done this year. And I'll cover a little bit more about that in a second. So this is our volume for PET. PET, of course, is now the nuclear medicine mainstay. The general nuclear medicine part is pretty stable. The PET volume has been growing year on year. Up until 2017 is as you can see, but then the last 2 years it's grown about 25% year on year, in addition to what we see here. And just to very briefly talk about therapy, theranostics has been around for a long time. We've been doing for iodine, for thyroid cancer specifically. In 2017, we participated in the trial for Lutathera, which then became clinically approved in 2018. So fundamentally, what theranostics means is that you've got a target, which is the subtype 2 somatostatin receptor. Octreotide is a somatostatin analog peptide that we've known about for a long time. Octreotide imaging was based on that. And then along came gallium-68 PET-CT, which is the diagnostic that now can find the same disease better because it's a PET imaging. And then using the same pathway, once you can see that there is disease, then you can treat it using a beta emitter, which is the Lutathera. And this is currently quite extensively being done throughout the country. Rochester is quite a leader, and we are the leaders in the Southeast United States in terms of number of cases treated clinically. So this is the overall picture of what we have. There's a lot of growth. We're adding another faculty member. We just officially posted for that, and much more to come.